So I am Shannon. I am a student in the BA program, and this is my presentation. This presentation is going to showcase my journey to plan and facilitate a successful teleconference meeting, which was one of my primary roles during my practicum. I was lucky enough to complete my practicum with the Canadian Cancer Society in Vancouver. The Canadian Cancer Society is a national community-based organization of volunteers whose mission is the eradication of cancer and the enhancement of the quality of life of people living with cancer. The program that I was working with during my practicum is called Run to Quit. Run to Quit is a national smoking cessation program that pairs the quit smoking expertise of the Canadian Cancer Society with the Running Room's Learn to Run clinics. Participants are supported by a trained coach through a gradual 10-week Learn to Walk or Run clinic in combination with evidence-based smoking cessation strategies. My roles within this program included general program promotion, stakeholder outreach, and volunteer management, which is the foundation of my practicum-based case. My practicum-based case follows the journey I took to learn how to plan and facilitate a successful meeting for volunteers across BC. The skills that were applied during this time include problem solving, effective communication, and knowledge translation. The meetings that I planned occurred bi-weekly and involved myself guiding the BC Run to Quit volunteers in a discussion of what our current and future activities entailed. These meetings were very important as they served to connect the province-wide volunteers, as well as keep everyone accountable to their specific roles. During these meetings, I also guided the volunteers through any new materials that was made available, such as social media toolkits, information sheets, and Excel spreadsheets that needed to be populated. During the initial planning process, I had to figure out a recurring day and time that worked for all the volunteers to participate in these meetings. Everybody had very different schedules. In order to determine this day and time, I decided to initiate a doodle poll. Doodle is an online system in which electronic poll questions are created by the user, sent out to participants, and the participants provide feedback as to which works best for them. This technology effectively solved my problem as I was able to use the poll results and set a recurring day and time that worked for everybody. This completed the primary planning process of our volunteer meetings. Actually leading the meetings came next. During our meetings, I enabled each volunteer to speak freely by calling on them individually, leaving them to have an open space in which they could talk about their activities. After our meeting, I asked the group for feedback regarding my clarity, and their responses left me confident in my ability to communicate. While my oral presentation was practiced during our actual meeting, my written communication was practiced afterwards when I sent out the meeting minutes. As I did not have the opportunity to display any body language, my written language had to be clear in order to get my messages across. And this was a great learning opportunity because it gave me insight on what works and what doesn't work during e-communication. The final skill that was implemented to help me run a successful meeting was knowledge translation. Knowledge translation was a huge component of our volunteer meetings because during this time, we took the Cancer Society's information and discussed how to transform it into promotional material that was appropriate for the general public. In the end, the volunteer group and I were able to participate in very successful meetings, which led to contacting over 1,000 unique stakeholders across the province. The Canadian Cancer Society will use what we learned through our meetings in future program promotion. The PHSP values that were reflected during my practicum were partnerships with people and populations served, and interprofessional and multidisciplinary approaches. Oop, not yet. So partnerships with people and populations served was reflected in the relationships that I built with the volunteers. I found that by reaching out and individually contacting the volunteers, we were able to lead the meetings with a more conversational style, which benefited everybody because any issues were addressed efficiently. And interprofessional and multidisciplinary approaches were also shown with the relationships with all the volunteers. Even though we were all from various professional backgrounds, we were able to come together and find out the best way to promote this program. In the end, the teamwork ultimately led to a very successful group of volunteers. And thank you. That's a picture of me at a health fair that I was promoting the program at. And I'd like to say thank you to my supervisor, named Liz Gilgan in Vancouver, and to Betty and Lynn and all of my other classmates. Thanks.
Thank you very much, Shannon. What questions have we?
Oh, teleconferences. So what do you suggest about the dreaded dead air in teleconferences? What can you do to keep people from just zoning out?
I personally called on the volunteers by name, just so that while we were going through our agenda, which I sent out, it kept it moving fluidly. And if we got to the end of a notice, then I would just move to the next one. But at the beginning of the first meeting, there was some dead air. And the only girl that I knew personally at that point was another student. And so I just called on her because I knew she would be okay with it. And I was like, do you want to start us off? And she was like, sure. And then I just made my way through the list. And they said that they thought that was really, my supervisor was listening, and she said, that's a good way to go, just so no one gets awkward.
Thank you, Shannon. Any other questions? No? Okay, thank you so much, Shannon.